pronouns are she, her, hers. I am the Director of Systems of Care and COACT at the Behavioral Health Administration. COACT is a SAMHSA federally funded program that implements high fidelity wraparound. And currently, COACT Colorado is supporting 15 communities of excellence in a total of 17 counties throughout the state. So each community of excellence receives funding to support wraparound facilitators, family advocates, infrastructure development, and flexible funding services for families. Before we move on, I want to let our moderator jump in real fast, Tanya, really quickly to mention a few housekeeping things. Tanya?
Hi, everybody. My name is Tanya Hotman, and I worked with COACT Colorado for many years on communication and community engagement. So I want to just tell you a few things about our plan for the day. Firstly, if you can keep yourself on mute, that would be so helpful. Our panel is going to have some great things they're talking about. And so to be respectful of their time and everything they have to say, if you can keep yourself on mute. We will have a Q&A later. And so if you, from time to time, think of something you'd like to ask our panel or one of us, just throw it in the chat. And we will also be getting to those questions a little bit later. And anybody we don't get to today, we'll make sure and loop back around with you. But again, we're really, really excited about you being here. Crystal.
Thank you, Tanya. So we are all here because we understand the various ways of mental health can impact children, youth, and families across Colorado. This is where my program, COACT, fits in, as it offers high-fidelity wraparound approach to help children, youth, and families with serious behavioral health challenges and complex needs. High-fidelity wraparound is an evidence-based care coordination model in which multiple systems come together with a child, youth, and their family to create an individualized plan to address the family's needs. Each child and family has their own individualized team, which includes a wraparound facilitator, a family support partner, a professional with natural supports identified by the family and the staff. The team honors the strengths, voice, and culture of the family to build self-efficiency and achieve success at home, in school, and within the community. Wraparound in Colorado is designed to serve families from ages 0 to 21 years of age and who have significant mental health, emotional, and behavioral health challenges, who are involved typically in 2 or more child-serving systems, such as mental health, medical, juvenile justice, child welfare, developmental disabilities, or education. So this is why I support high fidelity wraparound, because it provides that huge step which children, youth, and families with complex behavioral health needs. And if you would like more information in regards to my program, please reach out to me directly. And my contact information will be available at the end of this event, but I am always available. Just send me an email. My phone number is on my text as well on the bottom. So yes, thank you again for being here.
Great. Thanks so much, Crystal. And just a reminder to keep yourself on mute. We are recording this, so there will be access to the program later should you want to go back and watch it again, or if you have someone you know who may want to access the program today. So Children's Mental Health Awareness Day is going to get a little kickoff with our panel. We're going to let them introduce themselves a little bit more, tell you about their role, but this is reflective of a group of folks who work all across the workforce, either adjacent to high fidelity wraparound or in high fidelity wraparound. So we're going to go alphabetically, and we're going to start with Maria Carrion Ayers. Maria.
Hi, everybody. Good to see so many faces. Tanya said my name is Maria Carrion Ayers, and I've had the pleasure of working with COACT Colorado since 2018. And for them, I do class consulting. And so class stands for culturally and linguistically appropriate services. And in a broader context, I also work with organizations around the state and nationally to advance equity, diversity, and inclusion efforts through class practices. Happy to be here.
I think I'm next. So I'm Ben Fox. I stay busy in high fidelity wrap. I'm the high fidelity wraparound program like created it in Archuleta County, or started it up here for the first time, which is Pagosa Springs. And I've been the facilitator of our program here since 2021. I also now supervise Rocky Mountain Health Plan's 11 counties of COACT high fidelity wraparound programs, coach new RAP staff, help teach the Principles Meets Practice course through the CSTI or CU Anschutz, sometimes assist with developing training materials or help out really anywhere that I can. I really love living in Colorado, mountains, hiking, backpacking, rafting, and really proud to be supporting our rural youth and families.
Hey everyone, my name's Carmen Illisoy. I use she, her, hers pronouns. I wear a couple of different hats. I work with Youth Move Colorado, which is a youth-led organization made up of youth and young adults with lived experience in homelessness, domestic violence, mental health, other areas. And we do a lot of youth voice and engagement strategies on like the statewide level. I also serve as the program coordinator for the Youth HUD demonstration, Youth Homelessness Demonstration Project that was awarded to the Balance of State Continuum of Care from HUD. And then I also am serving as the program coordinator for the Youth Hub side of COACT's Family Youth Hub. So I'm excited to be here. Thank you all for being here. It should be a good time. Thank you.
And I'm Lorraine Rigby. I am the Peer Workforce Outreach Coordinator for the Colorado Family Hub. I was also a family support partner for High Fidelity Wraparound. They were talking about essentially that is the peer with lived experience that works directly with the families. So right now in my new position, I'm leading a lot for peer workforce, but specifically I'm doing support groups for those family support partners within High Fidelity Wraparound. But Colorado Family Hub as a whole, we're just building a network of family and caregivers and the peer workforce. The whole idea is to collect their voice, share their voice, and be able to use that to make quality improvement in Colorado's system of care. So tangible change, that's the goal. So we're partnering with everybody we can. COACT is a big one. And that's who I am.
Hi folks, my name is Andy Scott. I'm the Collaborative Management Program or CMP Administrator with the Colorado Department of Human Services or CDHS. I have been with CMP for 8 years. I started as the CMP coordinator in Garfield County and worked as a high fidelity wraparound facilitator in that role as well. And then in 2019, moved to Denver and worked as the CMP coordinator in Denver and supervised the high fidelity wraparound program in Denver. And now I'm with CDHS. I'm so excited to be here today and chat with you all.
Wonderful. Thank you, everybody. All right, so I think we will get started now on our main topics. And again, the way that we came to these topics for Children's Mental Health Awareness Day was through a series of some feedback that we had earlier in the year. So our topics today are largely based on what most of you who reached out to us said that you wanted to talk about and hear about. So our first topic is about relationship building. And for our panel, when you're creating mental health collaboration and partnerships to benefit young people, what makes a real difference in any community care coordination approach and why? So we'll start with that. And Andy and Ben, we'll let you two kick off your response.
Sounds good. I'll get us started. I would say relationship building is essential in any community care approach, not only with providers and the care coordination team, but also with natural supports. Friends and family members will be around long after service providers and care coordination teams have ended. And so building those relationships is just as important, if not more important, than building those relationships with providers. I think it's important for the care coordination team to model those relationship building skills, healthy relationships. Just like any other skill, relationship building needs practice, needs to be learned and practiced. And so having those models around and the practice to build those relationships is really important. When I was the CMP coordinator and high fidelity wraparound facilitator in the past, many of the young people and families that I worked with would say that they didn't have any natural supports. And so starting from there and having a discussion about who the people are in their lives, often those relationships had been damaged. So we were also talking about how to repair relationships, mend relationships, and continue to rebuild and build those relationships. And sometimes it's not, family members or friends. I had a client one time who identified his landlord as his natural support, and we worked really hard to include that person in their planning and to build up their relationship with them going forward. So I think relationship building is essential, not only to the success of the mental health of young people, but their families and their communities as a whole.
Thanks, Andy. Yeah, that was what I was going to say. No, and so I think that on that same sort of vein, though, the things that really stand out to me, and I think it really speaks to that point of relationship building, is it's really important that we are part of the community too, right? And that not only that we necessarily live here, but that we see ourselves as providers or as care coordinators as part of the community. So live here, shop here, right? Spend your downtime here. In our community, so many historically speaking, so many of the services were coming from the next closest city over, which is about 60 miles away. People are surprised when we tell them that we live here, like down the street, right? And there's a little bit of buy-in automatically from that, but I think it also makes a difference because the connection is really hands-on and direct. Right? So the people that I serve are neighbors, cooks at my favorite restaurant, like literally the one plumber that ever answers his phone, a teammate maybe on a pickup soccer game at the park. So I know that every professional and personal interaction I have will have lingering impacts. And this isn't just with clients that I know are clients. This is like if I'm checking out at the grocery store, I'm balancing that professional and personal like ethic and standard all the time, and reminds me to just always treat people with kindness and respect. So that really works toward building relationships. And I think that from the professional standpoint, and this is maybe more from a rural perspective, but I think applies everywhere, is in care coordination, we also need to not just support the needs of our clients, but consider our professional supports as more than just a tool towards supporting our clients. So we can often overlook how often they might be going above and beyond their required scope, or maybe be above and beyond their compensated scope. Like I can think of so many times that teachers or therapists are doing work that they aren't being paid for. And so in high fidelity wraparound, one thing I love about it is we're tasked with building a care team that includes professionals, peers, and family members, and they're part of a team. This doesn't mean that you're here to talk about them. This doesn't mean that we're taking sides. We're all working together. So we have to consider and move forward the needs and goals of our professional team members too, when we're talking about making a difference in community care coordination. So how can the team improve compliance with the probation plan? How can a high fidelity wraparound team or plan support a therapist's goals in the downtime between sessions? Or how can we prepare a youth to be attentive and engaged in school, maybe ease the burden of a stressed out school teacher? And then you take that one step further and you celebrate the heck out of it, celebrate those contributions, celebrate their value, bring them up over and over again, and then ask for a commitment moving forward, so that once your care coordination role is no longer there, that you still have this like network that you've created committed to supporting the families and the community.
Thank you, Ben. Did any of the rest of our panel have something that they wanted to add?
Yeah, I just wanted to add in the importance of diversifying like staffing models, I guess. Within the high fidelity wraparound space, there's only one certified youth peer support specialist that's there specifically for the young person, and they're located in Boulder County. And the importance of having a youth peer support specialist, a YPS is what they call them, is super, super important because, right, when you're like a young person in a meeting, typically around a bunch of adults, hopefully people you've all chosen to be on your team, right? Oftentimes language can be geared more toward like an adult, right? And so having a YPS there to be like, hey, like this is what they mean when they're saying this, right? And this is what like this word means, right? Or like, what can we do to like make these meetings better for you? And a YPS is so important also because they're typically closer in age, right? There's like an age range to the young person that they're serving, right? And so there's like that also like connection between like generations that oftentimes can be like overlooked when you have like an adult partner, right? Or support that's maybe like 20 or 30 years older than you, right? And so I just wanted to add that in to diversifying staff models. And that can go beyond just youth peer support, right? It can go to hiring people that look like the people in your community, right? And beyond, right? So yeah, I just wanted to add that as well.
Thank you, Carmen. I do think that maybe that does transition into our next topic. So we'll bring up the graphic. This really is about the impact of where you live. And that can look very different depending on where you are in the state. So the question is for our panelists, as it relates to youth mental health across the state, what is important in addressing unique challenges, be those because what's going on in a rural community is very specific, or what the opportunities might be in an urban community or a mountain community are really affecting how people are accessing mental health. So we're going to kick that question off. Carmen, we're going to go right back to you.
Okay, cool. Yeah, I was thinking a lot about this. A lot of my experience is rural mountain communities. But I think a big one that that we see and that young people experience is this idea of like lack of anonymity, right? This idea of everyone knows who I am. And like oftentimes these communities are so small that perhaps the only mental health provider in your area is like your parents' best friend, right? Or maybe is your aunt, right? And so like, and as we know, of course, like there's confidentiality and all these like ethical things, right? But people do talk, and that is like a common a deterrent, I think, for young people in these small rural communities. And then with that as well is oftentimes, right, these communities, their local centers are one street long, right? And so if you have a mental health center that's in the middle of everything, right, and you have all your neighbors, all your family members like watching you walk into that center, right, there's oftentimes chance to create all of these different narratives, right? And as we know, mental health is still very stigmatized, right? And so that can be like another deterrent. So oftentimes it can be helpful to neutralize those locations, right? Perhaps like maybe putting those mental health providers in like a community center where it's not as obvious that like you're going out to seek like that kind of support, or maybe even a library or at a school or things like that. Another important one I wanted to note was this idea that a lot of mental health resources are concentrated in the bigger towns in rural areas. Like, for example, I live in Durango, right? And Durango is considered like the hub of resources in this little corner of the world in Colorado. And so a lot of people will live out of city limits, right? And will have to travel into, right? But what happens when you don't have a car to get to Durango, or we don't have a bus system that goes beyond city limits, right? And then what can happen, right, is you just have young people not reaching out for resources. And that's where the importance of like having mobile models comes into play, right? Like instead of like young persons, having to come to you, like you bringing the therapist or the coach or whatever that may be, or the drop-in kit to those places, rather than them having to come to you. And then that can also, jumping into the mobile outreach, telehealth is a big part of that, right? Expanding like those more stereotypical like online therapy models, right? Or coaching models. But even with that, like another thing to highlight in rural communities is Wi-Fi is hard to come by. I think where we live in the digital age, and I think like me included, sometimes I'm still like, oh no, there's like, you can get service anywhere. But Wi-Fi is a big, big deal. And having access to Wi-Fi, and when having that access to Wi-Fi, being in a safe space to use that Wi-Fi, right? So those are just a couple of things I wanted to mention, and I'll pass it on to Lorraine to expand.
Yeah, I can piggyback off of a lot of what Carmen says, as I'm from rural too. But I think it's important to look like across the board, for almost all regions, the system is just hard to navigate. And a lot of that has to do with like language and messaging. They say, I don't know what it is, it's supposed to be like everything should be written at like a middle school level, just so it can be understood by all. So when you're talking about the youth not understanding, I mean, they really probably don't understand. Even the adults, it's hard. And that's also hard. It would be nice if people understood, especially like what's paid for. That seems like a really big barrier. Like, we can't go to the regular doctor. We definitely can't go to therapy. But also, I think it's important to understand there is definitely that stigma around mental health, but also people's past experiences. It's like maybe, they went to DHS and it didn't go well. And so they're at the point where it's like, hey, I've tried and nothing happened, and I've tried and nothing happened. And so just understanding, and I feel like that's what high fidelity wraparound is sometimes. It's like once everything else has failed them, there they are. And then I feel like families say like, wow, this is the first time it's worked, which is amazing. And a lot of that's because we're helping them navigate the system. They're not doing it themselves. But definitely for rural communities, yeah, there's a lot, just specifically barriers for that. I also feel like it's important to look at just kind of cultural aspects, people's opinions. Along with that stigma, you have like some of those like cool rural cowboy people, that are like, well, I grew up pulling myself up by my bootstraps, so it's not that big a deal. It's like my kids just need to suck it up, or, especially if they're a male, it's like, okay, my teenager boy, like I went through worse than this, you just need to get over it. But the really sad thing is in a lot of these high mountain towns is where suicide is really high. And all of that could be prevented with reducing that stigma. But then it's also a lot of the parent education. If you're going to want to help the youth, a lot of it's parent education. For example, like in Gunnison County where I'm at, we have around a 30% alcoholism rate. And so it's like if the parents are drinking, they're not too concerned about the kids drinking. But if the kids are drinking to cope with something bigger, then it's just kind of swept under the rug. And I've also worked with families that have the misconception, sometimes they're from different cultures, that say like, well, therapy is only for crazy people. And we're not crazy, my kid's not crazy, we don't want it on their record. And so I think it's really important to kind of break that barrier of being able to communicate what, positive mental health and behavioral health is. And it doesn't mean you're crazy, but it's just trying to reduce that stigma. And like Carmen said, lack of transportation, it does seem like there's a lot of, it's usually you have to go to the next town. That's just the hardest thing. And so for a not so fun but realistic example, so most of our resources come from Montrose, from Gunnison. And we have like the big lake, Blue Mesa, and the bridge broke. So you literally, for a while, just couldn't get there. And then they came up. So I guess this is the other thing that has pros and cons, is looking at some seriously like creative solutions. And so one of the solutions was like, we had 10 kids across on the other side of the lake who couldn't come to school. So then they started boating them, you know, but then the weather gets bad. So then we're going to do school just like we did with COVID. We're going to do it through the online, but then there's no internet. I feel like there's so many things, but being rural, it opens it up for a lot more creative solutions than maybe you would in an urban setting. The urban setting would be, you know, your only requirement is like, you know, you're going to go to the therapist in your network that's the closest to you. So, which is amazing, but in rural, you can't necessarily do that, but it also opens up some options. So we're talking about like what's it called? Teletherapy, telehealth.
Yeah.
You can, so some of those youth that maybe would have never found and maybe wouldn't have connected with that one therapist in their network can now reach somebody that they can connect with. For example, like the LGBTQ community. Now that opens up a whole world. We aren't so connected. So just keeping the options creative and open. And then another part with that, with keeping things like flexible and open, is looking at like the non-clinical approach. So for example, in high fidelity wraparound, we have the peer supports, and we definitely need more youth supports. But when you look at some of the cultural pieces, especially with families that are like, oh, you know, therapy is for crazy people, we just need to get over it. But when you say, well, can they meet with a mentor, like a peer? What if they just hang out with like another cool person after school, and parents are like, they're totally cool with that. I mean, so it's just opening up different options that can essentially do the same thing, or maybe even better, especially with peers who have lived experience, who can relate, who can speak the same language. That's a big one. And so I feel like the biggest thing across the board would just be able to be creative and flexible in what service might look like and what actually works best for the family. So yeah, that's what, I mean, if we had to address it, I feel like there's a lot of things, but I would start there.
And I saw Maria and Ben and Andy, I saw you all nodding your heads in agreement. Did you want to add anything or support what Lorraine was talking about? Thank you, Lorraine, for being so specific.
I'll jump in real quick, and I think both Carmen and Lorraine did a really good job of kind of covering a lot of like the gamut of a lot of the challenges and comparisons you can make, and just building off of what they both said related to technology and how to really leverage that to benefit you wherever you might be, right? So maybe you are in one of these rural communities, and how could that improve access to providers, particularly with that piece that Carmen said about anonymity, which is a really, really big deal. And it is really hard to kind of get around, and could be a really limiting factor for families wanting to come forward and be able to meet with somebody. But if they say, hey, you can connect with somebody that isn't even here, that might feel better. And when it comes to connecting with families who may have a different cultural background or speak a different language, technology can be a huge asset there, in that maybe you don't have a pool of qualified trained interpreters in the small rural community which you live in, which is a reality for a lot of our communities across the state. How can you tap into telephonic interpretation services, or even better video remote interpretation services, so that you're able to connect with the family, you know, have conversations that are inclusive of them, but also helps helps them better communicate so they're not having to rely on their kid for that interpretation or have to explain a lot about, what this means. So just to foster that communication a little bit better, rely on technology. And again, keep it in mind that there are limitations, like Carmen said, that you may not be able to get Wi-Fi. So how do you work and how are you creative, to Lorraine's point about the limitations that you're facing?
Yeah, thanks.
Oh, go ahead,
I'll
Ben.
go for it, Andy. Yeah, sure. I'll be really brief. I think one thing I wanted to touch on that I think high fidelity wraparound does really well and does it really almost require, I mean, I suppose you could say literally requires of us, is giving natural supports. So the friends, family, unpaid people that our clients rely on an equal seat at the table. So you're sitting at the same table as the therapist, as a school teacher, as a probation officer. And I think that works to start unpacking, regardless of rural, urban, mountain, starts to unpack some of those challenges that we're talking about, of not necessarily the language translation, because we don't really want them there for that, but the like understanding or aligning with your personal or unique values, or sometimes even maybe my neighbor has internet and I don't. Maybe my neighbor is going to Durango this weekend and they could give me a ride. And so I think when we start to think about bringing in natural supports to the table for treatment and for care coordination and for behavioral health, we start to see that the community, no matter how big or how small, actually holds many or most of the solutions itself. And we tend to keep those people out, like historically. And I think that's the high fidelity wraparound is really changing the tide, so that we're starting to see that, all of these challenges can be influenced positively by having these natural supports at the table.
I just wanted to acknowledge, I think the challenge, no matter where you live in Colorado, of staff shortages, clinician shortages, and long wait lists and high turnover. And, I think Lorraine and then just Ben, with your comment, both mentioned like the importance of non-clinical supports, and really leaning on like those mentors and peer supports and natural supports, maybe a faith community, and hopefully, folks that are going to be there whether or not they're paid, because I think oftentimes families get discouraged when they make a relationship, build a relationship with a provider, and that person moves on, or quits their job, or goes on maternity leave, whatever their situation is. So I think just enhancing those natural supports, so that when providers do turnover or there's a long wait list, we have those kind of built-in supports.
Great, thank you so much. I think we'll transition to our last question, at least the one that is not in the chat. Just a reminder, everyone, if you do have questions, you can throw them in the chat and we'll start to read those in our Q&A section after this question. And we would love to hear from you what any of this conversation is spurring in your mind. What is it making you think of your community? What are your needs? Things that this panel might have some expertise or some guidance around. So again, throw those questions in the chat and we'll be there in just a second. This question and our final topic has to do with the way people, young people, see themselves, who they are, and the intersection of those identities. I think what I'll say is observing as a parent and someone who's worked again alongside this workforce, it is really encouraging. I think the world around us is now opening their eyes to the fact that we're not all just one person with one single identity. We're a complex mix of all of our experiences together. And so that really does lead to this question. You understand, the panel does understand, that culture, language, and diverse experiences do matter. Would you say something's working effectively in Colorado to recognize, understand, and support children's mental health through these frames? Maria, we will start with you.
Yeah, thank you. So I think one of the things that is working well is that there is being more attention and recognition to not only the different identities that Tanya had mentioned, but the need to, not only provide the support to the children or the child and youth, but also that that child isn't an island, right? And that that child depends on the community and the families around them. And sometimes where there could be a little bit of a hiccup or a disconnect, particularly if the child is bilingual, is that the parents may not be as aware or as involved because there's a language barrier there. So I think it's really effective when organizations work to not only recognize that and address that need and gap and make sure that they're providing not only the family the support it needs to be able to communicate effectively, but the staff itself. So even in situations where you may have somebody from within high fidelity wraparound that is able to speak the language of their family, it's really important for that person to be able to operate in their role without having to jump back and forth with those different hats, right? To be the facilitator, to be able to embody that fully and completely. Because anybody who's ever been in that role knows that that's pretty all encompassing and a really big task in and of itself. And so by having that language support provided by a trained and qualified interpreter just allows everybody to be able to communicate more effectively. So it allows the kid to be able to just be the kid and, be in that conversation and talk about their viewpoints, excuse me, express what they're feeling for their multiple identities. They're a child of an immigrant, and they have to maybe have all these burdens that they have to, do and carry and kind of bringing their parents along in this new country where they're now living. And it also, again, lets the parents come in and really try to begin to understand that, because sometimes, like Lorraine was saying, they may have a different cultural context and experience. And there's nothing wrong with my kid. We're not crazy. Why do you want to do all this? But really bring them along and understanding, excuse me, why this is important to their family. Because when I've had the opportunity to work as an interpreter for families who have children who are highly involved, I often hear them say, well, thank you so much, because I had no idea what was going on with my kid. This is the first time we've ever been able to really understand what's happening, what they're recommending, and just really to be able to participate. So I think it's really to kind of make sure that, yes, we are focusing on the youth, but the youth isn't an island, and making sure we're bringing everybody else along with them. Yeah, and I saw somebody's hand up, but are we holding those up for later, Tanya? I'm not sure.
Yes, let's, I think that was Bobby. Bobby, if you'll put your question in the chat, we will get to it in just a second. Go ahead.
No, I'll go ahead and pass it along to somebody else on the panel.
I'll go ahead. The question, going back to the question about, what's working in Colorado, and in my experience, family voice and choice, really leading the way is what's most effective in having successful engagement. And I think whether that relates to language or culture or race or any number of other identities, maybe religion, those types of things, I think being able to allow the family to say what they need and want out of a service can really help that engagement be more successful, and provide them with exactly what they're looking for. And so I think that's probably the most important part, in my opinion, of having an effective care coordination team, is really listening to the family on what they would like.
I'll hop in. I just wanted to talk a little bit about for youth and young adults, if done right, I think the importance of getting feedback through either surveys, focus groups. It could be through organizations implementing their own youth advisory board that actually advises the decisions that are being made. They act as very similarly to a board of directors. Can be really, really helpful in making sure that your systems reflect what young people want, right? There's this saying that a lot of you may have heard, nothing about us without us. well, heck yeah. I mean, I think it just makes total sense if you're providing a service for someone. You know, we need to be getting input from them about what it is they want and what it is they need. An example, there are many examples in Colorado I can talk about, but one within the space I'm in right now, which is under the youth hub of COACT's Family Youth Hub. In the past, we set up focus groups and different surveys and feedback loops for young people within the high fidelity wraparound space. And they were essentially able to say, give us input on some of the like challenges that they faced in the space, what they wish they could have changed, things like that. And the general consensus was, I just want to figure out how I can like better advocate for the things that I need in a meeting. That was like the thing that kept coming up over and over and over again. And so from that, we are partnering with Youth Move National, which is kind of the leader of youth voice and engagement at the national level, to create an advocacy training for youth and young adults within the high fidelity wraparound space. So they can learn things like, you know, if I want somebody on my team, how do I like ask a friend of mine to be on my team without feeling embarrassed or like shamed, you know? Or like if I'm in a meeting and like the goal that I have doesn't align with my family's, and I'm the only one that like has that goal, right? Like, how do I like speak up for myself, and how do I like make that known, right? And let my family and, you know, my partners like know that like, no, like this is really, really important to me. Or how do I, you know, how do I use language, or how do I kind of speak, I guess, with an adult, right? Like to get my point across, right? Because that's going to be a lot different versus like how I maybe would speak to like a peer, right? Within that setting. So just like different things like that, that I'm personally really, really excited about. And I'm excited that young people were like stepping up and saying, no, we want this. And so I think that's like a super awesome thing that's going on right now that I just wanted to highlight. But yeah, I'll leave it at that.
Awesome. Those are all such great things to consider here too. And this is it's great that this is such a topic that we're always talking about, right? I think the one thing I wanted to highlight that makes high fidelity wraparound work really well in culture and diverse experiences is it includes really a two-person workforce potentially, and we talked about this, the youth support being a third, but so it's at least two people are working with each client family. It's a facilitator and a family support partner. And one requirement of hiring a family support partner is that they have lived experience. The idea is that this helps to build rapport and trust with clients and provides valuable insight into like really the unique challenges that a multi-system family or multi-system involved family might face. I think one less explicit advantage though is that this helps to increase the intersectionality of a high fidelity wraparound team, especially if hiring is done intentionally with that goal of creating a diverse two-person team. I know I myself, I'm really fortunate to work with a family support partner who goes back many generations in my community. Her cultural or personal experiences are really unique from my own. And this has helped us to build a diverse network of partnerships in our community, but also to better connect with the diversity of families that we encounter. And one thing, I don't know if selfish is the right word for it, but one thing that I really love about this as well is that it helps us to identify and overcome our personal biases and blind spots. So often mental health professionals, if we think about clinicians, you know, you're one off, you're working alone on an island. You might have a clinical supervisor if you're new, but maybe you don't, or you don't have a team that you're collaborating with. But we're constantly collaborating to brainstorm better ideas, overcome barriers, and just to keep our personal selves from getting in the way of embracing the uniqueness of our clients, their unique culture, their unique strengths, and their unique needs. And so having that two-person team, a diverse two-person team, is just such a valuable resource for me to grow as a professional, but I think also to provide good service to our community and to our families.
I feel like there's so much we could say about high fidelity wraparound, especially in what's going good. I think I can just piggyback off of everything they said, because it brings their voice in, because they have natural supports. I always felt like, it was the system that was helping them advocate for themselves. We always had like the little saying, do for, do with, cheer on. And the end goal always seemed to be that, they shouldn't have to ever use us again because now they have the skills. It wasn't a Band-Aid. It was a fix where now if they ever have a crisis again, or if something other comes up again, they know how to handle it, how to navigate it. But I want to say, in addition to that, maybe I'm just biased because it's what I do, but I love that in Colorado, I'm sure it's everywhere, but the expansion of the peer workforce. So that's everybody with lived experience. And I feel like that's the part that really helps build on like special youth and families' identities and their diverse experiences, is because they're working with somebody who's done it before. And I know that not all peers are in high fidelity wraparound. But if you think about it, just the peer workforce in general. So for example, family support partners, they got hired because they have lived experience. And I guarantee you, they've already been doing this work for a very long time, even without the label, without that. They might say, well, as soon as I got in a car wreck when I was 15 from drinking, I've been working with other kids, or I've been sharing my story all the time. And so the coolest thing about, the trainings within high fidelity wraparound, the trainings for the peer workforce is, they're not new to the work, but now they're just improving their skills to better equip people for success. And so I think that's the best part, is that now all these people who would have done the work anyways are kind of getting the skills to do it at the next level of like, hey, if you're having suicide ideation, now I know what to do about it. If you're in crisis, now I know what to do about it. Like, I'm not just your friend. I can actually help you advocate for yourself and be on your team. And yeah, that's what gets me pumped up. But definitely the lived experience piece within high fidelity wraparound and within the peer workforce, in general, just to have people able to have somebody to relate to that has their same experiences, that can help them walk through it. They don't have to be alone.
Great. Thank you so much, Lorraine. I know we do have a couple of questions, so maybe we'll just go ahead and get to this last section of our program we're so excited about. And I have a couple of you who are eager to ask our panel some questions. And so I will actually, if you want to unmute yourself, Bobby Christensen, you do have the first position there, and then Megan will get to you right after. Go ahead, Bobby, ask your question, and I'll put it in the chat as well so others might be able to see it.
My question was, I am a self-advocate and I work with families as well as individuals. How can I use the resources that you presented today and have someone to contact in the future to gain more information when I need it?
Crystal, I almost think that might be a question for you. Do you want to jump in real quick?
Sure. Hi, Bobby. Thank you for your question. We do have a great variety of resources that COACT offers. I am happy to set up a meeting with you and provide any kind of resources that I can, just because there's a huge variety. So I don't know specifically what you're looking for, but let's set up a 30-minute, 45-minute meeting, and we could talk about what you need, and I'm happy to help.
That is a great opportunity because that will give me a chance to give you a variety of questions.
Sounds great, Bobby. I will reach out via email.
Okay, thanks.
Thanks, Bobby. Megan Lovelace, are you still on?
I'm still on, thanks. Sorry for the background noise. I have just a little feedback for you. I am a parent who has had RAP. And so I guess my question is, because this did really change our lives and change my child's life, huge, right? But what the huge difference was absolutely that our RAP coordinator was actually taking into account the voice of child and family collectively. And what we have found, having looking for services for since my child was born, oftentimes the youth and family voice is not weighted the same way, right? You get into group meetings, ISSTs, what have you, and they're really led by sort of these community professionals whom, and we love you guys and thank you, however, it's sort of an assumption that these professionals in the room have the answers and that we are sort of bystanders in that process. And that leads to more and more and more acuity. And RAP is really where you have that peer, you have that person with lived experience whom has already walked that path that is then coming into partnership with the humans who need that walk with, right? Bobby is a great example of a human who can walk with other humans. And so I think that the mental model shift that needs to happen operationally needs to happen not just within RAP, but outside of RAP, and where RAP can be a model to show other people in leadership roles when we give the power back to the voice of that family and that youth, because they do know what they need. And we sort of, maybe gear back a little bit on professional recommendations that don't work for families and just keep trying to stuff families into systems that aren't serving them, right? It would save everyone tons of money, stress. It would be so much less stressful for your organizations at the county level if you really just let those families and youth lead in those spaces. And I can't imagine how much money y'all would have saved as a state with just my family had we been in a space where we had been able to receive that that partnership, right, and be seen as whole humans. So love RAP, it's amazing. It would be so great if this was available sooner. And I know we're looking at tiered systems and we're looking at all these things, but I cannot shout it into the void enough. RAP should be available to families before they hit a certain acuity level where it's just a mess and it's a crisis. And then you have, entire families living in their back brains because they're so stressed and they've been in crisis for so long. Why not offer RAP sooner? Why not allow for the compassion and the care that comes with RAP to reach even more families before it's a crisis, without needing child welfare involvement, without needing criminal justice involvement? Just giving this great service to communities and allowing families to know they can lead in their own lives. That's the magic of RAP, and we shouldn't keep it from anyone. So I know I'm asking for a unicorn, but I just had to say it because RAP is so great, and just so much love to my RAP coordinator and how she saved all of our lives.
Thank you so much for sharing your story, Megan. And I just want to say that, after working in both in RAP, and then I know you mentioned ISSTs as well, like that's for those not familiar, that's from the CMP space. It's a huge culture shift for a lot of folks, like you mentioned, whether that's probation officers or child welfare caseworkers, that they feel like they know best for families. And we really have to educate and get folks on the same page that families know best for families and young people know best for themselves. And it's hard. I'm not gonna lie. I've been trying to do it for a while, and some folks just don't want to hear that. And so I really appreciate you bringing that up. And I'll keep fighting the good fight. But also, I think in my role at the state, I'm really trying to impress upon CMP coordinators across the state who are facilitating ISSTs, that family voice is essential to the success of any interaction with families, whether it's an ISST or they're doing wraparound, or even just like a intake, being able to hear what families are saying and listen to their wants and needs. So I really appreciate you bringing that up, and we'll keep doing my best to push that your voice forward.
Yeah, I'll jump in really quick too. First, thanks for sharing that too, because that's why I do the work, right? Is like I just love to hear, and it's really great to get those testimonies too, because I think there are so many people that are uncomfortable with this idea that you might know best for yourself, and not because people I think are against helping, but because it's very hard to, when you go out into the world and you try to help somebody, when you realize that you were doing it wrong, it's really uncomfortable. And I'm just speaking on my own experience from this. When I first started helping people, I guess in whatever capacity that was, I thought it was my experience and gives me really great tools that I can impart upon those around me to equip them to go out and do better, right? What I've learned and where high fidelity wraparound is really connected and like changed me is that I learn from the people around me and the people that I'm trying to serve what they are doing that works really well. And I'm mostly just reminding them and highlighting to them and highlighting to their support networks, like how many great things they're already doing, more than anything. And so when I think that it's really uncomfortable and it's really hard, that probation officer wants to help those kids. And sometimes they're doing it wrong. And it's hard for you to look back and say, well, I've been in this field for 30 years and maybe the way I've been doing it actually wasn't the most helpful. That's a really hard thing to stomach. And some people just don't refuse to stomach it. But I've also seen, and in my little community, there was no high fidelity wraparound until 3.5 years ago. The people that we've had, the professionals that we've had on our teams, this idea is infecting them. They are now seeing that their students and clients have much more power and capacity than they were giving them credit for, right? And they are evolving. And also, I'm a couple of years ago, I finished my master's in social work, and I think that our educations in social work are also teaching us this now, and I think that that's new. And so I think that we have a lot of, I think there is momentum for what you're asking for, that this is going to be an idea that fits in everywhere. It really makes everyone's job easier also from the practical standpoint of like, how can I empower my family instead of doing things all myself as a professional? And so stick with it, but also stay loud, like get loud and yell at people about how well high fidelity wraparound worked, right? Keep that up, because like that's also what we need. Is we're still pretty niche, right? And we need people out there saying this worked, this really transformed my life, and you need to integrate this into the work that you're doing. So thanks for sharing, and also stay positive. No, I like it in the chat. Thanks.
Thank you so much, Megan. We love that passion, especially today. I know we don't have another question in the chat, and if one of our panel wants to talk about something that came up or that they thought of, I think all the perspectives have been increasingly important in talking about something else that we have addressed in the last few months has been taking care of the workforce. And we know just through your stories today alone that that does become really challenging sometimes, especially when you're a team of two in a rather large region. I'm wondering if any of the panel wants to talk about the practical and maybe emotional ways that you're taking care of yourself, because we know when we take care of ourselves, we can take care of others better, and how we're taking care of our teams, especially.
I can hop on this one. We're talking about caring for the workforce. So unfortunately, you know, when we talk about turnover and staff shortages, there unfortunately is like a really high turnover, especially for people who are doing their job with lived experience. A lot of that is from triggers and those sort of things. So when I was talking about, you know, it's nice that these people that are already doing this work that they've been doing forever are now getting some of those trainings. So a lot of that would be, you know, like the grounding techniques, self-care. Self-care, actually do it, I'll just stick with. I would say self-care is a huge thing. And then also organizations. I mean, my dream is if like organizations could just like push or pay for like self-care. Like you are required to take a day off every month and tell me what amazing things you did for accountability. Because a lot of the people in this field, we just want to help people. And so if there's a giant caseload and there's a shortage of workers, I mean, we're going to jump in there. I feel like everybody just wants to help is going to do that, which kind of puts, you know, the workers themselves on the back burner. So I feel like really pushing the self-care piece for the workforce to be able to sustain what they're doing. I mean, them taking care of themselves is going to trickle down to the families. And when you look at that perspective, you taking care of you helps you better take care of the families, then it's a little bit easier switch. It's not like a selfish choice to do something that you love and need.
To build off of what Lorraine was saying, I think, you know, any support that we can provide to our care coordination team, clinical supervision, coaching, you know, I love what the Family Hub is offering, you know, the kind of the peer support networks. You know, in CMP, we're starting some regional group meetings for CMP coordinators to just share you know, what they're experiencing and what's worked for them, what hasn't worked for them, and hopefully they can learn from each other. And I think self-care is like such a, I know it's like commercialized now, like, you know, get your bath bombs or like go take a spa day. But I'm the kind of person, I like my supervisor really had to force me to do self-care, and including like when I was sick, like you have to take a day off, you know, like you need to get better. So sometimes self-care is just like healing if you're sick, or, you know, maybe going to the doctor, or, you know, that kind of thing. And, you know, just taking care of yourself in a way that you can continue to show up for others.
I think another thing I just want to add, because I feel like in this space, we oftentimes like hold a lot of different hats, right? We're doing a lot of different things. And I think at the individual level, like I would love to see, and I've seen some actually agencies require this as a training, boundary setting around learning how to say no, learning how to say my plate is full. I can't do this anymore. I think that's a really difficult thing to do in spaces like this, where you have teams that are really, really small. But I think it's super duper important when you're looking at the quality of care you're giving, right? If you have like, I mean, it's just kind of science and numbers, right? If you have 15 things you're working on, you can't do all 15 things of those things really, really well, right? If you like hone those down to 5 things, totally, like you can probably definitely tackle all those things really, really well. And so, yeah, that's just one thing I would add to that as well.
I don't want to go first. I do want to add one more thing, kind of piggybacking off of what both Andy and Ben said, I'm sorry, about, you know, number one, not having enough people in the workforce, and what Ben said about being really intentional of having that workforce be reflective of your communities. And I think I'm seeing a positive trend in this direction, to where we're valuing that lived experience a lot more than maybe the alphabets that, you know, the alphabet soup that comes behind your name, and thinking about creative ways of not only how do we take care of the people that are currently within our workforce, but how do we recruit folks into that workforce that are reflective of the communities who are valuing that lived experience? And what could we do to support the workforce? Maybe they don't, or that potential new workforce, maybe they don't have the credentials and qualifications that they need at this point, but maybe that lived experience is more valuable. And how do we either guide them through those credentialing processes, and how do we support them so that once they get there, they have those additional tools that they need, so that we're able to, again, help the existing workforce there by having more people to carry that load.
And Maria, I'm wondering if Angela, are you able to kind of pop in and talk about what you put in chat, just for those who might be on the phone, because you were talking about some of the workshops and supports.
So COACT offers a 4-part series, which is 16 hours total, called Strengthening Resilience to Prevent and Address Secondary Traumatic Stress. And it addresses individual level factors, our work and personal relationships, the work itself, and things like organizational factors, as well as our bigger systems, like how do we deal with child welfare and justice, all these big systems, as well as systemic racism and systemic injustices. And so it's not training, it's a workshop, and it's very experiential, where it's different from most other workshops we do in our lives, but really thinking about like kind of the unique needs of this workforce, where many of us chose this field because we come in with our own life experiences, but that also puts us at higher risk of secondary traumatic stress and having struggles with the stories that our clients are bringing to us. And so helping us through all of that. And it is required for support partners in wraparound, because they requested that it be required so that agencies would have to let them come and pay for their time to come. But many people in all different workforces participate.
And it's a really good course. I think that I'd taken so many self-care related courses beforehand. I really like that you're going to leave it with tangible things. And it just takes a bit of a different perspective to some of the same kind of ideas. Plus it gives you a chance to really deep dive. And 16 hours is a good bit of topic, and it's not like time wasted. It's really well spent. So that's a really good course. Thanks, Angela. I did want to add a couple things to this, because I think that we're at an interesting point with high fidelity wraparound, and it's been illustrated to me in a different way. So I've started interviewing or supported our teams in interviewing for candidates. And one of the things people ask is, how are we going to be supported? And they aren't, in these situations, they haven't been asking around around the self-care and like time off so much. What they want to know is, am I being supported as a professional in developing and working with complexity that makes me uncomfortable or that I'm not prepared in? And I think right now we have what takes a minimum of 16 months realistically to get through your credentialing and high fidelity wraparound, where you're working with a coach for a minimum of 40 hours. You have 80, 90 hours of required training. You're essentially 2 full processes of working with 2 different clients. Almost every intentional engagement with a client is being reviewed and scored and coached on, so that we have a really competent workforce, right? Competence is such a key part of satisfaction in helping professions, and not just feeling competent, but like knowing that you are helping families in an effective and good way, and that you're growing as a professional. Where we are at right now, we have this incredible structure that exists in high fidelity wraparound, and what is always a risk when things expand is that being less palatable because of the expense of training and supporting and encouraging these staff. So I think right now is a really great time to just remember that that is such a key part of self-care, is building competence and supporting in professional roles. I'm really proud of what we do with our program under Rocky Mountain, where we have access to coaches. We have myself as a supervisor. We have monthly trainings that we do that are professional development. There's always 2 or 3 contacts that you can get a hold of at any time. Really, we have, we're available to answer questions. And I think we also offer, I know we also offer clinical supervision, and really like the whole scope of helping indirectly, helping intentionally, helping in a scheduled way, being there to support our workforce is something I'm really proud of. And I just hope that everybody is able to consider that this is really complex work, and supporting and training our staff is a really complex process.
And I just I'm sorry, Tanya, I just want to do a little baby echo real fast. Coming from within leadership, there's leadership above me as well from the BHA. We do take a huge lens and view in regards to provider burnout and just burnout is, in this work field. It happens. I've been in this field for over 15 years, and I totally get it. So that is something that we are, vigilantly looking at right now, and how can we provide, an assessment that's just, more ideal, more realistic. It doesn't, cause so much burnout. Like, let's make this such a smoother, more transparent assessment versus, causing more trauma or more burden, whatever the case is. So, that is something that we talk about on a regular basis within the BHA. And there are a lot of huge, changes to come in the future. So we do look at the workforce, and we do appreciate all the hard work that you all are providing out there.
And Crystal, the one remaining question in the chat might be something that you can touch on here as we kind of look at wrapping up. I do want to honor that a lot of you have stuck with us for 90 minutes, and we are super excited about that. And that if we can, answer any questions later on, we're about to tell you how you can get in touch with us. But the question is, what is the plan to expand accessibility for high fidelity wraparound across the state of Colorado? And I know some questions regarding that are definitely going to be like panel specific. You may have some ideas, but Crystal, do you want to just kind of talk a little bit about what the idea is in expansion?
Absolutely. I know, within the BHA, we are working closely with other, teams. We're collaborating very closely with HICPUF, CMP, Andy Scott. She's amazing. And we want to, provide high fidelity wraparound as more of a, a transparent option to families out there in Colorado, because right now it is not as covered as we'd like. So that is something that is in the works. Unfortunately, it's not at my leisure to discuss, what's going to happen because this is all contingent, of course. But this is something that is on the radar, and it is important to us, the work that's being done, and we want to expand ultimately the high fidelity wraparound workforce.
Great, thank you. And if that question is, specific to an area, I would think one of the first things you might do is get in touch with one of the ASOs or the provider that's nearby you in a region. All right, do we have any last questions, or we are going to move to the last section? Okay, great. And just remember, if you don't have a question, if you'll keep yourself on mute, then we will wrap this thing up. All right, Crystal, I'll throw it over to you again.
Thanks, Tanya. So thank you again for joining us, everyone. I'm so proud to be a part of this collective of people. If you want to find out more information about COACT Colorado, the future opportunities that might exist within your community, or if you just have any questions, here's my email on the screen, crystal.soto@state.co.us. You could also go to coactcolorado.org, and it does have my contact information on there as well. You could find more information in regards to high fidelity wraparound on that website or the YouTube page. Other than that, thank you all for being here. This was a huge lift, and appreciate my panelists as well. Thank you for being here and providing this time. Have a great afternoon, and we look forward to seeing you all again in the future.